Good morning, Davis month. It is 25 March. This is your morning update. I'm Chief Master Sergeant James Lotta, Command Chief of the 355th Wing. To start off with our numbers, this morning there is 331 cases confirmed in the state of Arizona, 43 in Pima County, with 5 total deaths across the state. Fortunately, because of you and the good practices, Davis-Monthan remains COVID-free. So thanks for what you're doing out there. I want to start off this morning by acknowledging Colonel Gonzales' dirty tactics over the last few days. So he used some cockpit footage 2 days ago. I admitted yesterday afternoon that I don't mind losing to the A-10. I guess I kind of know what our enemies feel like now. But then yesterday afternoon he pulls out Simon Sinek. So he goes the celebrity route, trying to gain some likes and some views. And so I want to say thanks to Simon. But I'm a little bit disappointed in Colonel Jolly having to resort to such tactics. So this morning I thought that I would counter, and I would bring along with me one of our local celebrities here on the DM, Colonel Bart Kenerson. Good morning, sir.
Hey, thanks, Chief. Thanks for having me.
So this morning, instead of talking about facts and data and the changes across the base, because I think we've done a really good job hitting on the CDC, the BX, the commissary, the hours and the changes in the FAM camp. What I want to talk about this morning with Colonel Kenerson is taking care of airmen, taking care of each other. So I figured we would just ask each other a couple questions, talk to the audience out there, and maybe give you guys some tips on taking care of each other. So Colonel Kenerson, this thing has been ramping up over the last couple of weeks, and there's been a lot of concern about the base closing, mission essential, maybe shutting down the mission, us reducing our footprint. If we start moving in that direction and we find ourselves more confined to our houses with our families, less access and less ways to get away, what are some of your ideas on being able to take care of one another?
Well, I'll tell you, that's one thing that I do struggle with quite a bit. You know, as Colonel Drowley and Chief Light have talked quite a bit. I'm a big talker, right? I'm a social animal. I love to engage with people and talk with folks, but you don't have to stop doing that. Part of that thing is you still have a connected family that you can get with, whether you're, over the phone, you're going to get some of the goodness part about this is you can still, hang out with your family, get to know them a heck of a lot better. There are some good things that have come out of the fact that the restrictive movement and the different things that could be out there, that it's going to actually make us a tighter team. You got to communicate up and down the chain. You got to continue to check on each other. It's everybody's job to do this together to ensure that we're looking out for each other and having that social connectedness that is very, very vital. One, overall to your well-being and to your health and to your mental stability. So I just ask is just keep doing it. The other thing is get out there and get exercise. Just because the COVID-19 out here doesn't have to change or alter your life of getting out and getting involved. And one thing I have to say is the chief and I have this great bond, and he's a beast, by the way, when it gets to getting out there and riding on road bikes. The guy's a monster. But how we vent and how we solve problems together as a team is we get together, we get out there, do massive road bikes, and that's a challenge. I will tell you that if we get the opportunity, we'd like to challenge Colonel Drowley to a road bike ride out there. He rides the A-10, and we ride the bike. We ride the machine of pain. He gives the pain. But Chief Lighter, thanks for asking that. But the big thing is continue the connectedness, get to know each other. Don't forget about those folks that are out there. Make phone calls. You can still talk to people. Just maintain the 6 feet distance in between each other. It doesn't mean you have to stop. You can still engage.
So, I think it's important as well that our leadership teams are really engaged with our airmen. They've got a big task of over-communicating with the airmen. But I think it's also important to remember that guys like you and Colonel Drowley and Colonel Pereira, you need to remember every once in a while to put your mask on first. Chief Wright talked to us a few months ago about leadership being willing to put their mask on first. So, every time you get on an airplane, you get that briefing that if the oxygen mask drops, that you should put your mask on before helping others. And, I want to talk to our commanders, our chiefs, our shirts, our leadership out there and remind them that you need to put your mask on first. You need to make sure that you're taken care of so that you're able to take care of your airmen, your squadrons, your units out there. Yesterday I took a knee. My allergies flared up. I wanted to make sure that it was my allergies, so I put my mask on first. I needed to make sure that I took care of myself so that I was ready today to take care of 11,000 airmen. And I think it's important that our teams out there remember that as well. There was a good ride this weekend. In fact, it was 2 rides this weekend. We got in 87 miles. So I look forward to riding some more maybe this weekend.
You betcha.
But also want to remind folks out there that, I don't fly the A-10, so I can't give you cockpit footage. I can't call Simon Sinek, but I can bring Colonel Kenerson in, and I will tell you that I still need you to click those little thumbs down at the bottom to give me a fighting chance against the wing commander. So for the team out there, remember, fight the virus, not the policy. Take care of one another. Look after each other. Make sure that you're being good airmen, good citizens, and go wash your hands. Rescue and attack.